happy and healthy.
This is a new series aimed at providing older adults with resources on health, fitness, finances, and other services.
Happy and healthy.
Welcome to another edition of Happy and Healthy, a series that's devoted to providing connections for you in the community with services available to older adults and their family members. Today we're going to be talking about managing chronic diseases. I'm Louise Thompson. I'm the Executive Director of Tampa Bay Community Network, your community media center, where you can take video production training and have a show like this yourself. Just give us a call. With us today are Barbara Roberts, and she is a public health nutrition consultant and a registered dietitian with the Florida Department of Health's Health Promotion and Education Division or Department. Welcome to you, Barbara. Thank you so much for being on the show today.
Thank you.
Craig Bobick, who is the Administrative Coordinator at USF's Diabetes Center. So today we're going to talk about how to manage chronic diseases. You can give everybody some hints, but in the meantime, could you first talk about your particular department or the Florida Department of Health, what it does and what your organization does as well?
Yeah, the Florida Department of Health, Hillsborough County, where I work in health promotion, we have several chronic disease programs we manage. We have a diabetes prevention program, a diabetes education program for people with diabetes. We have the Stanford University Chronic Disease Self-Management Program, and then we have a GIFT weight loss program.
GIFT?
For Get Into Fitness Today.
Oh, okay, great. Talk about the USF Diabetes Center, Craig.
Yes, the USF Diabetes Center is located in the Morsani Center for Advanced Healthcare on USF campus. And we have a multidisciplinary team and offer a whole host of services dealing with diabetes, clinical care, especially for pediatric children with type 1, adult care for adults with type 1 diabetes, and those with type 2 that require insulin therapy. And then, of course, we also offer a lot of education classes for all types of diabetes to try to really meet the need in the Tampa Bay area.
Craig, I think a lot of us are confused about what diabetes really is, and you talked about 1 and 2. Could you explain those to us first?
So diabetes is a relatively complicated illness for sure, disease for sure. Basically, by definition, diabetes means that you have an inability to control blood sugar. So when you eat something, your body converts that food into sugar, and then your body, your pancreas, produces insulin to carry that sugar into the cells for energy.
That's if you're normal.
That's if you're normal.
Okay.
If something's broken in that process, you have diabetes, and depending on how it's broken determines what type it is. Okay. So a person that may be starting to have some problems with blood glucose control in the early stages but don't quite meet a clinical diagnosis of type 2 diabetes would be considered to be pre-diabetes. That's kind of before they actually get the disease. So
how do you know if you are?
Typically you start to see some symptoms, and that's why it goes unnoticed. A lot of times people will start to, especially after a high carbohydrate meal, like say at breakfast and you have a bagel and you have some hash browns and things like that, and you find yourself like an hour or so later feeling very fatigued and tired. Could be an indication that the blood sugar is going up beyond what it should be going up to.
So sugar, which we think gives us energy and makes us more energetic, is not doing that. It's doing the opposite then.
Well, the sugar's there to make you energetic, but the insulin is either not there and not working properly, or the cell doesn't want the insulin, so the sugar doesn't get in. So if you can imagine that the cell has a key hole to a door, and the insulin is that key to open that door to bring the sugar in. So if the insulin isn't there at all, that's type 1 diabetes.
Keyless entry? No,
I wish.
Okay, all right.
So type 1 diabetes, the person has no insulin production whatsoever, and in that particular case, it's autoimmune. We're talking about 5% of the total diabetes population. So out of 26 million people that have type 2 have diabetes, type 1 is about 5% of that. So it's an autoimmune disease where the body attacks the cells that make insulin, and therefore there is no insulin production whatsoever. In type 2, you probably have insulin, but the cells are resistant to it. And it could be any number of reasons why that happens. Genetics is an issue, inactivity is an issue, obesity is an issue. All of these things contribute to becoming a person with type 2 diabetes, and understanding what that means and how you're supposed to adapt and the lifestyle changes that need to be made is what's important. And of course, there's gestational diabetes, which occurs in those that are pregnant. It doesn't happen to every pregnancy. But it can happen in pregnancy, and those that have gestational diabetes might be at higher risk for type 2 later in life. So those are the different types of diabetes and what we're looking at. And you know, obviously nutrition and activity, all very important.
Barbara, as a dietitian and with the Hillsborough County and Florida Department of Health, how do you help people with this disease manage?
The nutrition is a huge component of the diabetes. It's heart-healthy eating and managing your carbohydrate intake. And then, of course, exercise, checking your blood sugar, taking medicine as you need to, that kind of thing, too.
Sometimes these things conflict, like you could have more than one disease, right?
Correct.
So then what happens? You're told on one hand, these foods you should eat or not eat, but then you're also somebody on dialysis, for example. You have a renal issue.
Yeah. For someone on dialysis, again, the nutrition guidelines are even more extensive than with diabetes. So, like you said, they do definitely conflict. So you have to kind of just manage them, kind of try to find some kind of balance there too.
If you think in any way that you're pre, how would you tell someone, advise our viewers who might think they're pre because they're getting tired after? What should they avoid? The bagel with the home fries, or I mean, are they gonna lead themselves down the path to this by not adhering to some diet? Or
with the pre-diabetes, it's not necessarily the carbs. It's the ultimate goal with pre-diabetes. Extensive research has shown is losing weight, about 7% of your body weight, and exercising 150 minutes a week.
So it's not about diet at all?
Not specific diet components, but weight loss through a healthy diet, of course, or a weight loss diet, whether that be low fat, heart healthy, of course, is the goal.
I think the interesting thing is if people ate the way they were supposed to eat, the diabetes diet is really not much that much different.
Correct.
So it's a matter of
variety. You mean it's the same thing as the pyramid we have?
Well, the pyramid is gone now. It's been replaced with the Choose My Plate, which is a little bit easier for people to look at and say, I need to divide my plate up into quarters and decide, you know, and have more grains and fruits and vegetables and things like that. You know, if you look back to hundreds of years ago, we got all of our sugar from fruit. That's where we got sugar. We didn't get it from a box. We didn't get it from a roll of sweet tarts or anything like that. We got it from fruit, and with fruit comes fiber, and your body digests that in a much different way. So a lot of the obesity and the diabetes that we're seeing is directly related to the amount of straight sugar consumption and sugary soft drinks. And you know, I tell a lot of people, don't eat out of a box. Can you avoid eating out of a box or a package and try to eat the fresh things? And those things are the more healthy, the healthier options, and are the same things that a person with pre-diabetes or type 1 diabetes or any type of diabetes really should be following, and the same kind of goals that a healthy person or a person that's trying to be healthy should be following. So the packaged items and the sugar and the fast food and the high fat should be every once in a while, with the norm being a general healthy lifestyle that hopefully reduces the risks and management of chronic disease.
And exercise.
Okay.
Definitely.
Absolutely.
And what other chronic diseases do you handle with the Department of Health?
If you are diagnosed with the pre-diabetes through a blood sugar test that you can get from your physician, we do have a program for that. But the other chronic diseases, of course, we have the diabetes education. The chronic disease self-management program is for someone with any type of chronic disease, so whether that be heart disease, high cholesterol, high blood pressure, depression, arthritis, anything like that.
Depression is coming under chronic diseases?
Mm-hmm.
Okay.
Yes. Yeah. So any kind of mental illness, or if you're a caregiver for someone with a chronic disease, you're welcome.
And you have programs for the caregiver as well?
Mm-hmm. Well, part of that chronic disease self-management evidence-based program is a chronic disease program for the person with chronic disease plus the caregiver.
Is this offered free to the public?
Yes, all our
How did they
programs.
find out about it? Did they go to Hillsborough County or to
Yeah,
Florida
they can.
Department of Health?
Yeah, Florida Department of Health, Hillsborough County, and I'll give our website.
What are the other things that are being done at the Diabetes Center? You guys are doing research, no doubt?
Oh, absolutely. We have a fairly extensive research program in type 1 diabetes. Let me back up a second. USF, as a university, coordinates some of the biggest diabetes studies internationally, believe it or not. Lots of money in coordination, staff of over 100 to coordinate international studies in diabetes. One of the studies that we're looking at looks at family members of people with type 1. So as an example, I have type 1 diabetes. I've had it for 31 years, diagnosed at age 10.
Oh my.
And my brother, who's 4 years younger than me, also has type 1 diabetes. So there's a study that looks at family members. So my 2 daughters get screened every year to see if their immune system's starting to possibly act up a little bit and attack those cells to make insulin, with the hopes that we can maybe find out who's at risk and then intervene, stop the process, retain the insulin-making cells that belong there. And that's part of trying to prevent diabetes from occurring in the first place. So that's a big study that we're actively recruiting.
Is there a possibility that they're going to find some way to head it off for your daughters and other, progeny?
There's lots of things that we're looking at. Interesting ideas like an oral insulin pill that doesn't do anything to blood sugar, but that might have an effect on the immune system and getting it to back off a little bit. There's some other therapies that are being tried with infusions that try to control the immune system, again, to get the immune system to not be confused and attack the cells that belong there. So that's a big study. We're also doing a lot of studies with type 2 in kids to look at medications that are currently used in adults to see if they can be used in kids that are overweight and have high blood sugar but are not type 1 diabetes. And of course, we do a lot with adults with type 1, looking at how they care for their diabetes, questionnaires, looking to see if they still have any insulin production, even though they might have had diabetes for 40 or 50 years. So lots of interesting things that we're trying to understand about both type 1 and type 2 diabetes. New treatment technologies that are coming out. There's insulin pumps. There's continuing glucose monitors that monitor glucose every few minutes, so you can see what's happening and trends that are happening. So lots of exciting things happening on the research front. In addition, the center, we expanded our center to 10,000 square feet in the Morsani Center. That includes a demonstration kitchen that allows us to film videos like this and cooking videos and do cooking demonstrations that are part of diabetes education and medical nutrition therapy. And those services are covered by Medicare and most healthcare plans, usually up to about 10 hours of education. So any chronic disease, the biggest problem is you go to the doctor says you have a chronic disease, and you walk out without any lead to know where to go to find out how to manage it.
Well, because they just write a script and say, here, take this
medicine. And we'll come back a couple weeks later and see if it's working. But they often aren't led to the next step, and that's the diabetes education, the chronic disease management, to understand, hey, I've got something. I need to figure out what I need to do to maximize my life, reduce the risks of complications. If you find out you have diabetes, well, what can you eat? That's the first question people want to know is, what can I eat? I really like to eat this.
Yeah, because nobody wants to find themselves having something amputated or,
Exactly.
because we always hear these horror stories, and that can be prevented or not.
Correct.
Barbara, how do you,
Yes.
by following?
Yeah, by the exercise, the checking your blood sugar, the nutrition, and managing the diabetes will keep you from having the dialysis and the blindness and the amputations.
It's pretty difficult I have a family member with diabetes, and controlling the sugar levels seem to be wildly difficult. And you were talking about this new devices. There's monitoring devices that are actually hooked up to the doctor's office or to somebody and gives you some kind of a warning before the warning, or, they got new things going on.
So there's
right?
all kinds of new things. To clarify that a little bit, there's continuing glucose sensors, basically, that are placed in the skin and easily changed and moved every few days, that read the interstitial fluid to look at what the blood sugar is, to give you an idea of what it is. that information can be uploaded via the internet or software to the physician that we can review and make changes and things like that. So that's becoming much easier to access and make changes in between visits and things like that because of those things that are available and because of the technology that's becoming more available.
I think, Barbara, I don't know if you could comment more on that, that until, like in the case of a family member, until there was some necessity for a possible surgery, and the doctor said, I'm not going to do a surgery unless you have the following things: the permission from the cardiologist that you're okay to go through surgery. You have to have, I forget what it's called, but when you, the control numbers that you keep your sugar in a certain level and whatever. And I think until the family members got involved in saying, how are we going to get your sugar under control because you are not, would we even know about these devices? Do you, in your education classes at the Florida Department of Health, do you tell people about these various new methods so they know that maybe it's not as complicated for them as?
Yeah, and we tell them, of course Craig is involved with all that research too, but we tell them about the current things on the market and encourage them to talk to their physician too about the new devices and those kinds of things too. Because like you said, monitoring is so important, and having the whole family or the whole household involved to help the person maintain that healthy lifestyle.
Yeah, you only once have to go through watching somebody look like they're dead, which I recently did with this relative. And to have gone into a sugar, what do they call them, like, look like a sugar coma or crash, or I don't know what the proper term is for it, but where someone really is completely out of it, non-responsive, you know, eyes a little bit back, not focused, this kind of thing. That was so scary, calling EMT and so forth. And I don't know how the person with it actually just either forgets or overlooks, or, you know, the sugar drop. I mean, I guess it just kind of happens on some people.
You know, unfortunately, the other organ that affects all this is the liver, and the liver stores a lot of sugar, and it's there for energy when you need it. And you know, if you walk out to the parking lot after work today and you get mugged, you're gonna have an energy to either fight or flight, and that energy comes from adrenaline and from the sugar from the liver. Well, any type of stress causes sugar to be released from the liver, so it raises your blood sugar without you eating. So if you're sick, your blood sugar can go up. If you're stressed, you get in an argument with somebody, your blood sugar can go up. My blood sugar might be up before this broadcast. I'm not really sure. I could check afterwards and see.
Okay.
But,
well, I hope we're not doing that.
No. But it's a challenge because all the day-to-day activities can affect what your blood sugar is.
And what you have to do then is to take insulin or take
your
a
medication,
pill, or
depending on the situation. Monitoring is very important. So knowing what your blood sugar is and what it does and how it changes under certain circumstances is very important. And it's different for a type 1 than a type 2. In my case, if I don't have insulin at all, I'd be dead by tomorrow. So it's important. I have to have the insulin to survive. So if I run out today and go for an extra run that I didn't plan on, my blood sugar is going to drop because my insulin's already on board. So it's a juggling act. I'm constantly trying to keep this range. Type 2 is the same situation, sometimes even more cumbersome because you don't have that insulin. You might not be on insulin to try to lower that blood sugar. You might not need that yet. So you could have fluctuations based, again, on stress or some food that you ate or pizza or pasta, those types of things.
So the best advice that you give at, well, I know you said exercise, diet, and so forth. Are there other things about controlling stress that you do programs on too?
Oh, absolutely. It's part of the curriculum for diabetes education, for chronic disease management. The depression aspect, the mental health aspect is very important because when you've been diagnosed with a chronic disease, depression sometimes follows because you don't accept it. You don't want to make those changes. And you're in an environment in the world where it's difficult to make those changes, where you're constantly bombarded with supersized meals and things put on your plate that aren't the healthiest.
And our social activities are all about around food, are they not?
That's right.
Mm-hmm. I mean, just to even, meet with your family or friends or whatever, you're always at a restaurant or at somebody's home, and they're serving
Where do
a
people meet at a
meal.
party when you're at their house?
Yeah.
Everybody's in the kitchen.
So what are the recommendations they make about controlling or managing stress?
Just find things to manage stress for somebody. It may be exercise, taking a bath, going for a walk, calling a friend. Just depends. And of course,
No Sudoku?
yeah. So
Okay.
perfect. Or and some people may need to take medication for depression or anxiety or other mental health issues too.
How do you get that figured out, whether it's going to affect some of the people and not all of the people? Or do you have some way of making assessments of that? And can it work the other way, where depression actually does something to the sugar level? Is that something you study at USF?
Sure.
Is that right?
Yes, absolutely. That we know we have a clinical psychologist on staff, and that's all she deals with. There's people that have diabetes and coping, and families with issues and coping, and caregivers. And you can imagine if you had a child that was diagnosed at 5 or 10 or 16 years old with type 1 diabetes, what that does to a family in the school system and those types of things. And then adults with caregivers, you have, as adults get older with diabetes, both type 1 and type 2, some of the other comorbidities or complications that occur just because of diabetes, where that could be some joint problems or, of course, depression or, mobility issues, things that start to happen as a result of getting older and having diabetes. And the caregiver has to know how to help address those issues. And again, try to promote activity and get people moving. And I always say, we always look at lifestyles. How often do you drive around the parking lot to go to the gym to get the closest parking space so you can go into the gym and then run on a treadmill? That doesn't make any sense. Try to find opportunities to take the stairs, to take an extra walk, to take extra steps that you might not get on a regimented exercise basis. So it's part of the lifestyle decisions that you can make that can reduce these possibilities, can keep diabetes away, that can keep you thin, that can keep you healthy, but they have to be part of your lifestyle. The diabetes center is on the 5th floor of the Morsani Center, and I try not to take the elevator up to the 5th floor. I take the stairs. Because I might not get a chance to walk tonight. So I have to find those opportunities. Park a little further away. Stop drinking sugary drinks and drink things that are nutrient-based.
Nothing with an umbrella in it, I guess.
There's some room for that. There's room for all these things, but it's a matter of moderation and control, and that's where people struggle.
Yeah.
You wanted to add something, it seemed like. Was that right?
Yeah, well, the lifestyle changes, but then, and it is difficult in today's world to make as many of those changes too. In a lot of buildings, you can't find the stairs, the elevator is all that's available. So you have to make a conscious effort every day to choose those healthy things most of the time, to exercise most of the time, to, you don't have to join a gym to get exercise. There's other little things you can do.
What are some of the things you tell people to do that if they're not joining a gym or they can't drive someplace?
Get a dog, walk your dog, go out and play with the kids, get a bike. Sometimes if it's safe to not drive for trips less than 1 mile, if you're driving somewhere for a mile and there's a sidewalk or there's an area where you can ride a bike or walk, do things like that too. Just little things as much as you can. Oftentimes in Florida it gets real hot, so go to the mall, go to a
there are
warehouse
a lot of walk
store.
groups in the mall, right?
Absolutely.
That do
Correct.
that because it's air conditioned and it's easier to get around. They do it, even some of the malls have it where they open for the walkers earlier than the stores open, I believe. Yeah,
That's right.
Is this true of other chronic diseases that you talked about heart, depression, you said also would work with some exercise or Sudoku. But some of the other chronic diseases, is there some advice you would give for managing those as well that's different from what you just suggested for diabetes?
Sometimes people don't realize that when you manage your chronic disease, it's not just going to the doctor. It's that you maybe only see your doctor every 6 months, once a year. He manages it for you while you're there, but you need to have an active role. You need to ask questions, ask for information, go see other specialists if you need to, take your medications, maybe exercise, find out other things you can do, because if you have the condition, you're the ultimate manager of your condition, not the physician.
Unfortunately, I think a lot of older folks have been trained to think that the doctor is the manager, because they came from the school of, don't worry about it, honey, let me, your doctor, take care of it, or something like that, and
Correct.
and didn't look at it that way. We've only got a couple of minutes left, and I want to make sure that you address something that I didn't ask you, that you want to make sure a viewer knows about either your center or the advice. So I'm just going to give you a minute apiece to do that. I'll start with you, Craig.
You know, I think the important thing is that whenever someone gets diagnosed with any type of chronic disease, is you have to be your own biggest fan. You have to know the questions to ask. You have to know where to look for the resources that can help you. And don't just throw your hands up and say, I have diabetes, or I have cardiovascular disease, or I have asthma, and I'm not going to do anything about it. You have to be responsible and look at these things that are available, and look at your insurance policy and see what's covered, what is available to you. Are education classes available in whatever chronic disease that you have? Look at what those resources are available. In diabetes, you have you know, the ADA and diabetes.org. They have a great risk survey that will analyze your risk for diabetes.
ADA, okay.
Yeah, the ADA. The JDRF is doing great things in diabetes research, and they have a couple walks coming up on the 6th in Lakeland and of April, coming up
annually. They do these, right.
But in the spring,
Yeah.
they have walks all around the area.
Right.
And then you know, so finding out what those resources are, and don't just sit back, be active. And then if you don't have a chronic disease, make good decisions about your lifestyle. Find
So
good
that you
things
don't
to
get them.
do. And all those things that we talk about, the exercise, the eating right, all those things cover a whole gamut of chronic diseases. It covers chronic cardiovascular disease. It helps reduce strokes. It helps reduce cancer. It helps reduce depression. That's what people need to do on a day-to-day basis. And if we can do that, we'll be
We'd
a
be
healthier.
good. You want to add to
Definitely.
that, Barbara?
Definitely agree with Craig. And then too, if you do have a chronic condition, look for support groups too. There's oftentimes support groups for the chronic conditions too. Just wanted to plug, we have a Partners in Obesity Prevention Coalition in the community. We have meetings quarterly to monthly that is a group of community members, some through their organizations and some private individuals working to fight obesity. And I'll give you that website too.
And
So-
there's a big effort with childhood obesity,
Correct.
isn't there not? Because that's a big problem right now. Well, thanks very much
Thank
to
you.
both of you for
Thank you.
bringing all these things to everybody's attention and reminding them of what I guess we all should know, but just giving us a great reminder. I appreciate the viewers being tuned in, and we hope you'll come back some other time. And we hope to see you next time on Happy and Healthy. Thanks for watching.
Great,
Thank
thank you.
Gaining weight was easy. All I had to do was sit down and eat. Losing weight's a lot harder. I have to work at it every day. But with every step, I lower my risk for type 2 diabetes and heart disease. And that makes every step, every choice, every day very much worth the effort.
Hi, hon. How was your run?
Hard, but I hung in there and did my 2 miles. How was your workout?
Great. Dinner's ready. I hope you worked up an appetite.
Healthy female like this, you better believe it. Thanks for keeping us on track.
Hey, every step matters. We can do this.
And it's very much worth the effort.
Learn how you can help stop diabetes by losing weight, eating healthy, and staying active. Visit checkupamerica.org or call 1-800-DIABETES.
When I have an asthma attack, I feel scared. Sometimes my parents have to take me to the hospital. I feel like a fish with no water.
You know how to react to their asthma attacks. Here's how to prevent them. Call 1-866-NO-ATTACKS. Visit www.noattacks.org or call your doctor. Because even one attack is one too many.